Okay, this is the lumbodorsal angle, and the doctor is going to prescribe it either to the right or to the left. And the way this is done, this is done at the end of your wobble chair exercises. So you would go through your normal routine, right, left, forward, backwards, do your twist, but you would end with this exercise right here. And so if I was going to go to the right, I put my right hand right above my hip, my left arm like this, and I'm going to do it, come to neutral. Go to the right, come to neutral. Go to the right, come to neutral. And so this would be for a lumbar spine that had a curve like this. We're going to go opposite that curve. And this will be done either on the right or the left, depending on what the doctor tells you. To the left would be for an angle that's going like this, and we're trying to straighten that angle out. And again, to the side, to the side, to the side. And that is the lumbodorsal angle exercise.